Hello, thank you for tuning in. I am Dr. Jeffrey Brown, and thank you for watching Power to Heal. We are in part 2 of our 3-part series on endometriosis. We are in the month of October, which I'm sure you all are aware of. It is Breast Cancer Awareness Month. And studies have shown that endometriosis actually increases your risk for breast cancer. So it's very important that we have a better understanding of endometriosis so that we maybe reduce our risk of developing breast cancer in the future. So today we're going to discuss endometriosis and its associations with inflammatory diseases and the immune system. Now, researchers have found that women with endometriosis are more likely to have asthma, allergies, and skin conditions like eczema. These are inflammatory diseases. Steroids are the most common treatment for these conditions because they are very potent anti-inflammatories. Endometriosis is considered to be a pro-inflammatory disease. Therefore, having endometriosis can signal or trigger the body into an inflammatory state. An autoimmune disease is where our immune system mistakenly attacks its own cells because it believes it is a foreign invader. Endometriosis is not classified as an autoimmune disorder, but endometriosis may increase a woman's risk of developing an autoimmune disease. The reason for this is not 100% clear, but one leading thought is because endometriosis is a pro-inflammatory condition. The resulting inflammation contributes to an imbalanced immune response. So there's another theory. Low testosterone is linked to autoimmune diseases. And studies have shown that low testosterone levels have been linked to autoimmune diseases in both men and women. Testosterone has a very strong effect on the immune system. Low testosterone levels signal an increase in inflammatory markers, and chronic inflammation can lead to autoimmune disorders. Women account for 80% of all autoimmune diseases, and we know that they typically have lower testosterone levels. Research has linked a few autoimmune disorders to endometriosis. They include multiple sclerosis, celiac disease, rheumatoid arthritis, lupus, inflammatory bowel disease. So knowing the connection between low testosterone and endometriosis, I believe that testosterone is a very important test to run. So I like to run that first. So testosterone has many health benefits, but I'm just going to mention a few. It decreases pain, strengthens muscles, strengthens bone, decreases excess body fat, it increases your motivation, it improves your self-confidence and overall well-being, it decreases anxiety and stress. So testosterone is not just for men. It's very important for women's mental, emotional, and physical health, as you have just heard. So how do you know if you have low testosterone levels, you may be asking? Well, if you suffer from any of the following symptoms, I recommend getting a blood test to check your levels. First is lack of energy or feeling tired, having a low sex drive, vaginal dryness, muscle loss or feeling weak, low motivation, depression or anxiety, reduced cognitive function, or brain fog. So you may be wondering what causes testosterone deficiency in the first place. Well, birth control, which is the most commonly prescribed medication for hormone imbalance disorders, chronic stress or psychological trauma, adrenal insufficiency, long-term use of corticosteroids, opioid abuse, surgical removal of your ovaries, and premature ovarian insufficiency. Now, there are some ways that you can increase your testosterone naturally. First is strength training, especially strengthen your legs, as that is the biggest muscle group in the body, right? Incorporate daily stress-reducing activities. I discussed this in the previous video, so if you missed it, please watch it. Increase your protein intake, and make sure you take a quality multivitamin and mineral that contains plenty of zinc, vitamin B6, folate, vitamin K, and also take vitamin D3 as it regulates the synthesis of testosterone. Now, there is no FDA-approved testosterone replacement for women, right? Everybody thinks it's for men. So testosterone must be made in a compound pharmacy. It can be given as a cream, injection, or implanted under the skin as a pellet. The reference range of testosterone for women is too low in my opinion. And so I see that most women feel better when they are in a higher end and even above the reference range. So it's imperative that you work with someone who has experience treating women with testosterone, because the side effects of too much testosterone can be very disturbing and you're not going to do it. And so what are they? Acne breakouts and oily skin. They can be cystic, very unpleasant, and you're not going to like how you look, right? Facial hair, right? Or loss of hair, enlarged clitoris, deepening or hoarse voice. These are symptoms, of course, that you do not want. So work with someone who knows what they're doing. All right, so inflammatory diseases, they start in the gut. So as I mentioned in our previous video as well, one important test that I recommend is the GI map test. Or a comprehensive stool analysis. You need to evaluate the gut and the microenvironment of the overall gut health. So next, I would recommend doing a food allergy and sensitivity test. Common food allergy testing measures only the IgE response. That's the immediate reaction that your body makes when it's exposed to something. Most people know what those symptoms are because they get this immediate reaction. But our bodies can become inflamed also through the IgG, IgG4, and our complement system. The IgG immunoglobulin causes delayed sensitivity or immune response, which can occur up to 72 hours later after exposure. And IgG4 is a protein that blocks the allergic reaction to certain foods that have an elevated IgE. So it's important to identify these foods. So therefore, utilizing special testing that does both food allergy and sensitivity testing is important. And minimizing these foods that provoke an inflammatory or immune response is crucial for giving your body the chance to heal. So remember, endometriosis is an inflammatory disease which can lead to an imbalanced immune system. So once we've obtained our results, our treatment protocol will look similar to the following. Testosterone replacement. I find that most women need it who have endometriosis. You got to eliminate the inflammatory foods that we've identified from our food allergy and sensitivity testing, and to also avoid known immune reacting causing foods like gluten, dairy, sugar, processed food, alcohol, etc. We also need to address the imbalances from the comprehensive stool analysis or the GI map test. Omega-3 essential fatty acids through our diet and supplementation is crucial. Omega-3s are essential nutrients, which means our body cannot make them, so we must consume them. They are anti-inflammatory, they are building blocks for hormones, and they help regulate hormone levels. So foods high in omega-3 fatty acids are fish and seafood, especially cold water fish like salmon, mackerel, and sardines. Nuts and seeds like flaxseed, chia seeds, and walnuts, those are also very good. So, make sure that you always work with professional grade, products, all right? Especially with fish oils, because they can be contaminated with heavy metals and toxins and other pollutants from our waters. I also recommend high quality colostrum. That's right, that pre-milk, from the, produced from the mammary glands, of female animals. All right, they have many benefits, for those. It boosts our immune system, it's anti-inflammatory, helps repair the damage to intestinal lining, and it keeps our gut microbes, in balance. Other natural anti-inflammatories like turmeric and ginger may also be used. So I hope you enjoyed this video. Hope you learned a lot. If you did, please like this video, share it with friends and family, and please don't ever forget that you have the power to heal. Thank you.